Let me ask another question. I don't have this question fully formed in my head, so I'm going to apologize in advance. But I do recall we had an issue last year with eligibility being held in place on recertifications for a period of time and the potential cost to the state of that. Have we gotten back to, or when will we get back to that being able to appropriately float? Because frankly, it saves money, for people to be off of Medicaid when they are not qualifying, as opposed to them being on when they're not qualifying. And I know that's part of that's the interplay between the two systems. When do y'all anticipate that issue that particular issue that has the budget implications being resolved, and any of those related issues being resolved?
Okay, Senator, I'll refer to slide number 21, which talks about the recertification backlog that we're working on to get down between now and the end of December. The key thing here is that with our counties being able to get that backlog done of the pending applications, we're down to 20,000 remaining. Most of the counties that we've been working with, they are working on those recertifications. They've continued to work on those as they've moved forward. We're trying to work down the backlog of the new applications. So I think that's the key thing to note, that all 100 counties have been working diligently on both. So as we continue to go down, we have seen last month as they were trying to work down as many of those for the pending applications that are recertifications, kind of spiked a little. We don't see it here, but we will see it in the coming month. But what we have heard from counties is now their concentration, as they've gotten their backlog from pending applications, is on recertifications. So the plan is for them to try and get those recertifications down before we hard launch. We've encouraged them to work those in the legacy systems, so that when we convert those over, they're already converted and recertified before they come in. So you'll see as we move forward in the next few months that the concentration moves from those backlogs of pending, because we're almost there, to the recertifications.
Follow up, Mr. Chairman.
Follow
up. Based on the goals that you have for the end of the year, so we would anticipate in January moving back to a system where you're not holding people as eligible when they are otherwise not eligible.
That is the goal, is to have all that done by the end, so that we stop that automatic rolling of the traditional, or the Family and Children's Medicaid.
Thank you.
Representative Ford.
Thank you, Mr. Chairman. Two quick questions. Number one, for Ms. Taylor, I heard a couple of different things. Have all the legacy systems been retired?
No, sir. The only legacy system that has been retired at this point is our food nutrition services system that was there. We are currently converting stuff out of our old eligibility system, and that is the goal by the end of November, is to have all of the active cases converted out of that, and they're totally in NC Fast. By the end of the year, we hope everything will be done in NC Fast. There will be a 6-month waiting time for us on our eligibility system, the old one, to retire that from our controller's office, doing any back payments that may be required from that legacy system.
Thank you. Question two, I don't know who can answer this. These unaccompanied minors, how many of them do we have in North Carolina?
Ms. Bradford.
Yes, sir. Thank you for the question. It's about 1,400 for the state of North Carolina.
Thank you.
Senator McKissick.
Sure. I'd first like to thank the whole team of you for all your hard work in some very difficult and challenging times. I know that you have a lot of responsibilities, and it sounds like you're carrying them out in a very admirable way. But the thing I was trying to get a grip over, though, is what's going on with the counties in terms of them having these sustainability plans in place to be able to continue to not just deal with the backlog of cases now, but what's coming in the future. I know I heard you say they're eligible for 75% reimbursement, but that leaves 25%, which I assume they have to pick up locally. You talked about, comp time and other ways of they might be able to manage it, but what are the locals able to do? Because I know there's a lot of disparity between the financial capacity to contribute at the county level. So, I mean, what are we looking at? What are we able to do beyond that 75%? Or what are the plans to help them cover their shortfalls, if any?
Thank you, Senator McKissick. And again, what we're doing is working with each individual county. It is a challenge. There's 100 counties out there and with different situations. And that's why we've sort of divided the counties up among us. In addition to the written plan, we're having phone contacts. We're obviously talking to directors, and we'll be following up with county leadership about this. And as much as possible, we're trying to educate county managers, county commissioners, board members about, with our DSS directors, help about the needs, current situation, and going forward, what needs to be done. Again, we worked really hard here at the department and in our different divisions and sections to work with CMS to get this opportunity for counties. And just to be honest, the ball is in the court, if you will, of the counties to come up with a plan. It may be different counties in different places. I know, like I said, some counties have already added permanent staff and are getting those trained. They were put in a new budget. And so those are counties that are probably in a better place sustainability-wise than a county that was just depending on comp time or overtime. So again, our OST folks, 24 of them, working with counties, going into counties, helping evaluate their needs, their resources, their productivity, that sort of thing. Those are all ways that we want to help support and assist county commissioners, county managers, and directors of social services in identifying their needs and hopefully coming up with a plan.
Follow up, Mr. Chairman.
Follow up?
And let me ask you this. I mean, how many of these counties, when they went out there and established their budgets going into this year, had some kind of projected dollar figure for the additional capacity they would need so they could appropriately budget for it? I mean, back in June when they were setting their tax rates, I mean, at that point in time, were you in contact with them, or was your team in contact with them enough so that they knew, based upon projected demand, what they would need to do to have the resources in place to meet this ongoing need?
Yeah, and we were working with counties then, looking at budgets. At that time, however, we had approval from CMS, which was retro to January and ongoing, for 75% reimbursement versus 50%, just for NC Fast. So our achieving the additional opportunity for the work in the EIS system going forward, retro to June 1, really for I'm sure about every county in the state, is additional federal reimbursement and less county expenditure than for the staffing they have in their budget. So it's a matter of, and I remember being in the county as a director, the 4 most favorite words I think of county commissioners was no new county dollars. And so we'll be working with our County Commissioners Association and others to try to help them to reinvest a portion of their savings, but also to help them identify what the needs are.
And Ms. Bradshaw, did you have additional comments to add?
I did, thank you very much. Being part of the process with a number of our counties going into the budget cycle, understanding that most of them had to have their budgets prepared by March and April in order to meet that June 30th timeline, many of these approvals and processes were unfolding. The truth of the matter is many under-budgeted revenue, so they actually have excess revenue coming in that they might not be showing in their budgets for this year. What we are asking counties to do is to look at that revenue increase and reinvest that into the additional staff that are necessary to prepare for November 15th and that increase in caseload that we've seen over the last 5 years.
Follow up, if I could, Mr. Chairman.
Follow up?
I'm glad to hear that, Ms. Bradshaw. That does sound good. Now, it sounds like a lot of that's been worked out with a 75% reimbursement. I guess will that eventually just fade out and the counties will no longer be eligible for that? Is that something that's phasing out after some period of time, or is that going to remain ongoing?
It is our understanding in working with CMS that the 75, I like to say it this way, the 75% is the new 50%. What has been 50% for eligibility functions for as long as I can remember is now 75%. I think is connected to our case management system that we have, and NCFAS meets those requirements. So ongoing, the 75% is will be the new norm.
Last question, Mr.
Final
Chairman.
follow?
Yeah, and I'm glad to hear the information that you're providing, because I've had substantially fewer calls coming from the counties over the last several months, so it was a clear sign indication that something positive was occurring, because before there were calls ongoing. But let me ask you this, I have had calls recently about what's going on in Wake County. So can you share with me what has occurred in Wake County? I understand the person who was in charge there is no longer there. So I see there were some issues here dealing with the way they were entering information into NCFAS. Are you at liberty to share some insights on what was occurring since they were a major urban county, and if that was simply unique to them?
Ms. Bradshaw?
Thank you very much. I'll be glad to take that question because a number of members on our team, including myself, have been very involved with Wake County over the course of the last several months. Wake County had an understaffing issue overall because of the caseload growth, and I believe they were able to add 30 additional staff. Wake County is a large county, and with any large urban county, their ability to turn things around quickly is relatively slower than maybe a small or a medium-sized county. They have been able to onboard the majority of those staff. We were also able to provide them with some resources so that they could look at their processes internally and make some recommendations for change there as well. So with Angie's staff and the new additional staff, we expect that Wake County is going to have a very strong sustainability plan moving forward.
Thank you.
Senator Tarr? Thank you, Mr. Chair. Just a couple quick points, just mainly for public information. I know the enrollment period for the ACA begins on 15th of November. How long is that period going to stay open?
Senator Tarr, it is our knowledge that the enrollment period will start on November 15th and go through December 31.
All right, great. And then another point of clarification. Can illegal foreign visitors enroll in Medicaid?
No, they cannot. Individuals are able to apply for emergency services only as an alien.
And I just wanted that to go on the record so people understand we're not doing that. And then kind of the last point of information, if I may, and then I guess comment, is what would your guys' recommendation be for anybody who is uninsured but doesn't currently qualify for Medicaid? Would you suggest they enroll in the ACA?
Senator Tarr, I would say yes.
Thank you. Great answer. And then the last thing, just to share with you, because this is the ultimate indication of what you guys have been doing for the last year and a half, 2 years, is our phones were ringing off the hook. Our emails and were just, the lines in the queue were unbelievable. I can tell you in the last 60 to 90 days, and I don't want to speak for the other members, 0 phone calls, 0 emails. That's an absolute reflection of what you guys have been able to accomplish, which candidly is nothing short of amazing. So going through a major implementation, major reorganization, all concurrent, and to be able to do what you're doing, I at least for one personally appreciate what you all are doing, and the fact that you sit here all day with us and get us up to speed, appreciate it.
Senator Tarr, on behalf of the department, especially coming from you, we thank you very much for your compliment.
Chairman Haas?
Okay, and I just kind of want to get at this. I think the question was sort of asked earlier and we didn't really get an answer, but I get a sense of what the department's dealing with, what we saw in Guilford County, what we're seeing now in Wake County. We've come up with a 24-person operational support teams and training. We're trying to educate county managers, develop these transitions. We're doing a lot in that area, but I guess the question I want to get at is we look for what the department and Medicaid should be in the future as we continue to grow. Is this kind of relationship with support teams and others, is that the direction we need to go? And do we need to continue with 100 different counties in the enrollment areas of Medicaid, or is there a different direction we need to look at in the future? And I know that's probably not a real easy question, but it was asked a little earlier, and I kind of wanted to see what your thoughts are in that direction.
Senator, perhaps I should take that.